Everybody, it's Russ Curtis, Professor of Counseling. I want to begin this one. This is still a part of our OCD series here, but I do want to begin by saying that I am not a medical doctor or a neuroscientist, and I'm going to put a link to a video in the comment box that does a really super job of explaining the details of this. But it is one, the reason I wanted to put this out here, the more behavioral health providers that know about this, as well as parents and maybe even you who've experienced this and had no idea what it was, just so that we've got some general awareness. But again, very general. So PANS, Pediatric Acute-onset Neuropsychiatric Syndrome, it can cause what looks like sudden onset OCD, among other things. So it's not just the OCD symptoms. Can be caused by strep. You may have had strep throat. And what I understand is that the antibodies created within the body to attack the strep somehow then create inflammation in the brain and sensitive areas that then lead to these symptoms. Again, the other video will help with this. Typically, ages would be 3 to 12, but it can be adolescent and even early adulthood could experience this. So you're seeing some of the symptoms, behavioral mood, and this is just some, just examples. Severe separation anxiety when that was not present before. Cognitive symptoms, academic decline, memory and focus issues, tics or abnormal motor movements, and sensory sensitivities to light, sound. Somatic symptoms, sleep disturbance, enuresis, bedwetting, of course, and then change in appetite, which could result in weight loss. And we already talked about OCD symptoms, so the intrusive thoughts, compulsions, and rituals. So the treatment, if it is caused by an infection, antibiotics would need to be on board. And then the anti-inflammatory treatments, since this is inflammation in the brain. But also what I was seeing was that the immune therapy seemed to be gaining a lot of traction in this as well. So I think there's going to be a lot more research and hopefully have some markers that folks can draw, medical professionals can draw blood and determine, oh yeah, this is what this is, and we're going to know how to treat it. But then in terms of psychiatric medications, maybe SSRIs or low-dose antipsychotics if behavioral issues are a real problem. And then behavioral and psychotherapeutic approaches, specifically cognitive behavioral therapy with exposure to the symptoms or to the feared thought or the obsessive thought, and then recognizing that, oh, I don't have to do the ritual or the compulsion in order to rid myself of the thought. Again, I think normalizing, that's one of the reasons for this video, is oh yes, this can happen. So normalizing is also a form of cognitive restructuring, I think, in a way. And then, of course, nutritional and lifestyle support. So just to give you just a brief overview, let me know if you have any thoughts or experience with this. I'll be happy to do more on this. But again, just with our series on OCD, something that may not be commonly known, PANS, and it's something as behavioral health providers we need to keep in mind. All right, good people, take good care. We'll talk to you on the next video.